About T cells and cancer treatment. Quick overview of what I will be discussing is what is cancer, specifically acute lymphomatic leukemia, what are T cells, how can we create chimeric antigen receptor T cells, and how these cells are used as cancer treatment, different side effects the patient might go through, the different problems that have been encountered by laboratories who are experimenting with the T cells, different trials that have already been conducted with this type of treatments, and cancer in Puerto Rico. So first of all, what is cancer? Cancer is a collection of related diseases where more than 100 types of different cancer exist. And cancer is whenever the cells in your body start to grow in an uncontrolled manner and they start crowding the good cells in your body. And this is where metastasis happens, that they start invading the good tissue in your whole body. Cancer may be treated by surgery or removal of tumors, chemotherapy, and radiation. Specifically for this presentation, we will be focusing on acute lymphomatic leukemia, which is the type of cancer that occurs in your bone marrow. The bone marrow are the soft inner parts of your bones where the new blood cells are made. So the blood cells in your bone marrow, they start reproducing when they are not mature enough, and they start invading the blood in the patient. The patients that are diagnosed with this type of cancer have a life expectancy of just a few months. Now, what are T cells? T cells were first discovered by Gershon and Kondo while they were doing different trials and experiments with the immune system, and they found out that these are the cells in your body, white blood cells specifically, that are able to recognize tumor antigens to attack extraneous bodies or pathogens in your blood and to activate checkpoints to kill the diseased cell that they are able to recognize. Now, the problem with this is that cancer cells are able to fool the T cells in your body, and T cells then are not able to recognize the antigens in the cancer cells. So that's why your body usually is not able to fight off cancer. However, scientists started thinking, how can they create a T cell that is able to deal with this type of tumors? How can they genetically engineer or modify these cells to make them even more powerful so that they could kill tumor cells in your body? And that is where chimeric antigen receptor T cells came in. These are basically living drugs that scientists and health doctors have developed to treat cancer, specifically the cancer in the blood. So the materials that they need to create chimeric antigen receptor T cells is the chimeric antigen receptors that are going to be inserted in the surface of the T cell, and they would need the T cells which are extracted from the patient's blood. They would need leukocytes to power up the T cells whenever they are going to insert them in the patient's body, anticoagulants, because whenever they're dealing with the blood in the laboratory, they don't want the blood to lose its consistency. They would also need a buffer to clean out the blood from any pollutants or contaminants it may contain. They would need the viral vector, which is the vector that takes the T cells into the tumor cell for the attack. They also need growth factors that would make the T cells grow into millions and millions of cells before infusing them into the patient's blood. And they would need the monoclonal antibodies, which are the antibodies that are gonna help the T cell kill that tumor cell. So just to explain the process into deeper knowledge of how they are created for the patient. So the first step is to collect the patient's blood. From that blood, leukapheresis or apheresis will happen, which is the separation of the components or removal of the contaminants of the blood, and that is where they start selecting what they want from the blood and what they don't want. In this case, they would start selecting the T cells from the blood. Up from there, they would need to wash out the cell. As I said, they need to remove all the pollutants it may have with the buffer. After that, they need to enrich the blood with lymphocytes because they need to create a very powerful cell that is able to survive in your body again. From there, genetic modification will happen, and how they do this is that they transduct a virus from a retroviral vector, and this retroviral vector is constructed into the patient's T cells genome. So they genetically modify the T cell to contain this receptor, and they start construction and inspection of the T cells by an ex vivo process that could be a gamma retroviral or a transposon system. From there, they start activating the cells by incubating them for a minimum of 2 weeks, and after they create millions and millions of these cells, they infuse them into the patient, and it can happen in a single dose or in multiple doses in a 1 to 3 day period, where cells start expanding inside the body and they spread out through circulation. So, thankfully, the CAR T cells have already been approved by the FDA in August 2017 for the treatment of acute lymphomatic leukemia in children. So, these CAR T cells, what they do is that they are charged with the antigen found in B cells, which is the CD19. And normally B cells are the ones who start dividing and developing into tumor cells. So the T cells are infected or charged with the gene of the CD19, and they're able to recognize this gene to kill the tumor cell, and once they are inserted or infused into the patient's bloodstream, the expansion and persistence of the treatment will happen. Just to summarize the steps of what I just said, the first thing that needs to happen, they would extract the blood from the patient. They will need to separate the T cells from all the other materials or molecules the blood may contain. They would genetically engineer the T cells with the antigen CD19. They will start expanding the cells into millions of them by an ex vivo process, and then they will infuse them into the patient's blood. However, before infusion, lymphodepleting chemotherapy must happen, and this chemotherapy needs to happen because what it will do, it would reduce the tumor load, and that way the persistence of the CAR T cells would improve once they are injected. That way, when they are infused, the T cells can start multiplying in the patient's body. Recognition and killing of the disease cells can happen, and this can ensure a long life for the patient. Now, some possible side effects that have been reported are cytokine release syndrome. This syndrome is a syndrome that would have high fevers and drops in blood pressure effects in the patient. However, this type of side effect may be treated with steroids, and the patient is ensured a better life whenever they encounter this problem. B-cell aplasia may also happen, which is where the cells of the antibodies in your body start dying, and still this side effect is compensated with immunoglobulin therapy. And the other possible side effect is cerebral edema, but there were only few reported, and they were reported when the patients were already too advanced in cancer, and they were just not able to make it. Some different problems encountered for T cells as cancer treatment is that scientists have not been able to use T cells for the treatment of solid tumors. And this happens because the solid tumors would normally have a microenvironment surrounding them that protects them really hard from the T cells, and they start killing the T cells instead of the T cells killing them. And there could also happen an antigen loss where the CAR T cells will not be expressing the chimeric receptor they were charged with, so they do not identify the disease cell in the body. For the different trials that have been conducted, there have already been 180 or more trials of the chimeric antigen receptor T cells. There's one specific trial that was conducted in 30 patients where 37 out of those 30 patients were able to recover from acute lymphomatic lymphoma, and they have not shown any signs of cancer again once they were treated with T cells. There are also different trials for targeting CD22 overexpression, which is another gene that is also expressed in cancer cells. There's also been different trials for creating a super T cell, which would be a T cell that may be charged with more than one antigen, for example, the CD19 and the CD22 at the same time. And there are also different trials that are being conducted for using T cells for the treatment of arthritis and collagen degradation, diabetes, and autoimmune sclerosis. Now, for the cancer in Puerto Rico, from the statistics from the Center of Disease Control and Prevention, there has been reported at least more than 1 million cases of different patients of cancer since 1999 till 2013. There are no trials in Puerto Rico that are being conducted right now for cancer treatments with T cells, but the American Cancer Society is starting to provide treatment for genetically modified T cells, and they are still developing future research to implement this kind of treatment in adults, because as I mentioned before, it is a treatment that was already FDA approved for children. So hopefully in the future, cancer treatment with T cells may be implemented in different cancer clinics in Puerto Rico, and that way different people that have leukemia, and specifically acute lymphomatic leukemia, may be treated with T cells. A summary of what I talked about is what is cancer, and specifically we focused on acute lymphomatic leukemia. We talked about what are T cells, how can we make the chimeric antigen receptor T cells, and how can we use them for cancer treatment, different side effects that shouldn't be worrying any patient, because either way you would only have a life expectancy of a few months if you are ever diagnosed with ALL. The problems that have been encountering for using T cells in other different types of cancer and for using them for leukemia, different trials that use T cells not only for cancer but for other diseases as diabetes, and the cancer in Puerto Rico, and how can we start developing new strategies to cure cancer patients. So if you have any questions, please comment below or contact me in any way possible. And here you have a list of my references.